Hare Krishna, dear devotees in Radha Des. Thank you for gathering on the occasion of Karuna Mayi's memory and also in the presence of Karuna Mayi's sister. I would like to speak a few words. So it's a little hard to say when I met Karuna Mayi for the first time. It's many years ago, maybe around the centennial, so Prabhupada centennial, 96, something like that. It's rare to have a person, devotee of the UK, who speaks Dutch. She served in Radha Des in the tour program, reception, book distribution, preaching. She was definitely a preacher at heart. And even many years ago, before I went to Mayapur, then she had a strong connection with Mayapur, and even more with Bangladesh. Because for a Mataji to be a traveling preacher in Bangladesh is actually a very daring undertaking. But she had that strong desire to preach. And although Bangladesh is a country with a lot of politics, Muslim influence, riots, violence, etc., her strong conviction that Krishna will protect her, and I would say combined with her compassionate nature and also her missionary spirit, that pushed her in taking the risk to preach in Bangladesh. Then once in a while, I would meet her in Mayapur over the last 10 years. But more recently, because I didn't have so much direct contact with Karuna Mayi, I would meet her because I know her, would speak a few words, and that was it. Because I had my service and she had her preaching service. So, and even more recently I saw her less because my understanding was that she was taking care of her mother. But due to her connection with Mayapur, she did come back to Mayapur for some months. So then suddenly in the morning I heard an announcement that Karuna Mayi was hospitalized, and so then I went to see her in the hospital, and she was unconscious, and so she couldn't speak, she didn't open her eyes. But when I spoke to her, or I tried to speak, to make a connection with her, I could sense that she recognized me. So the difficulty was that the owner of the flat, he had found her lying on the floor in her small apartment, and but nobody knew how long she was there in that position. So when there is a brain stroke and they find the patient after 6 hours or more, then the chances for full recovery are slim. In other words, in most cases there is permanent paralysis as a result. So in this case we didn't know, and then she was given, of course, immediately the proper medicines when she came to the Bhaktivedanta hospital, to the community, Mayapur Community Hospital. And Dr. Suki told me that, look, we are not really equipped for this type of cases. I think it would be better to bring her to Calcutta to give her proper treatment. So then with the ambulance she was brought to Calcutta, and there she was immediately underwent an operation to release the pressure that was there in the brain. So the operation went well, but after the operation we were waiting day after day to get some breakthrough, to get some news that, things look much better now. So it was always, there was not real progress, was not made. So then we started to be concerned, because if you are a member, citizen of the Dham, and then you go outside the Dham to an hospital, that's fine for improvement, but we wouldn't want her to leave her body outside of Mayapur. So then after some time, more than a week, 10 days, then I went to see her in the hospital in Kolkata, and she was not fully conscious, but she was also not fully unconscious. So then I saw her, and she opened her eyes a little bit, and I asked, because they told me she is not able to speak, because she also had they call it, I think, catheter in the throat for feeding something. So that didn't allow her to speak or anything. So then I asked her, first question I asked her, do you recognize me? And if you recognize me, can you lift your right arm? Because her left side was more paralyzed than her right side, or maybe only her left side was paralyzed. So then she immediately she lifted her right arm. And then I asked her, would you like to go as soon as possible back to Mayapur? And she immediately lifted her right arm again. So this is the only communication I had with her. And and after that also the nurse, gave me a sign that she's tired and that I shouldn't, stay much longer with her. She was in a very busy room with maybe 8 patients. It wasn't a very big room, but it was very busy. There were like 8 patients and 3 nurses who were there taking care of them. So then when I came back to Mayapur, and I spoke also with Saraswati Mataji, and then the next day we went, I said, okay, let's go and see Dr. Suki, because Dr. Suki had previously told us that, look, my role as a doctor is that we have to do the best for the patient. Because we brought up the point already before I went to visit Karuna Mayi in Calcutta, isn't it better to bring her back? Because, we would feel very, very sad, very bad if she would leave her body outside of Mayapur. So, but then at that time he persisted that. So then, after visiting her, coming back from the hospital next day, Saraswati Mataji, myself, I don't know if Pushpa Gopal was also there, but then we spoke with Dr. Suki, and he was immediately very much willing, because I was suggesting maybe we can bring her back on Monday, because I think that was a Saturday then, and so I told Dr. Suki maybe we can make arrangement for bringing her back on Monday. But some or other, he said, but why not immediately? I said, what do you mean? Now it's weekend. They are not going to. By the time we reach there, it's going to be Sunday. And he says, let me see. Let me talk with them. So he talked with them. He suggested that to pick her up immediately, and they were also in favor. Because one of the reasons they were also in favor is because they were afraid that she would catch some disease in the hospital, because there are so many patients, and she was until now she was okay with infections. So then Dr. Suki immediately made arrangements, finances, transport, everything was arranged. It went all very quick, very smooth. It was a little mystical how Dr. Suki changed actually his outlook to bringing her back to Mayapur. And then she came. She came in that night, and then she was brought into the hospital. She had her own room in the Mayapur Community Hospital. Pushpa Gopal Mataji, one of our friends from Spain, she stayed with her during the whole night, and then the following night she left her body. And Srila Prabhupada was there with the japa, with the Mahamantra, and Pushpa Gopal Mataji was there. So she came back and she left, which is very auspicious to leave one's body in the Dham after a lifetime of service. Karuna Mayi Mataji ki jai, Srila Prabhupada ki jai, Gaur Premanande, Haribo.